Let's go ahead and get started then. We're always fighting against time, so sooner we start, the better. Since most of us are here, we'll go ahead with. Do we have a volunteer to read the land acknowledgement? Anybody like to do that today? Anybody?
I can do that, Brad.
All right, thanks, Ken.
We recognize and acknowledge the indigenous land of which we live, work, learn, play, and grow. This is the land of the Warm Springs, Wasco, Northern Paiute, Tonino, Klamath, Molalla, and Yahuskin. We acknowledge them as the past, present, and future caretakers of this land. It is on their traditional land where we partner to improve the health and well-being of Central Oregonians. We aspire to be good guests, honoring the concept in the Warm Springs culture. This land is for you to know and live upon and pass on to the children.
Thank you, Ken. Appreciate that. All right. Very briefly, meeting practices. We're talking about meeting notes. We'll be voting on those soon. We want everybody to participate, speak up whenever you would like to, and I'll do my best to actually ask you to speak up if I'm not hearing from you. But other members of the CAC are also invited to do that, because sometimes I get caught up in my thoughts and forget to do that. Yeah, we just want it to be a welcoming environment and invite everybody to participate actively in whatever way you're comfortable doing that. So you can use the chat, you can speak up, you can use the reactions. I believe in the reactions at the bottom of your screen, if you've never used those, you can raise your hand. Oh no, that's not, yeah, it is. You can raise your hand, and I'll have to ask for the staff or anybody to, if I'm not acknowledging somebody with a hand up, please let me know, because I can't always see everybody on the screen. So, and I think that's it. So introductions, Kelly, can you help with introductions, please? Or whoever
Yes,
would like to. Okay.
Yep, I'll get those going. So we'll start with our CAC members. Let's start with Brad and then Linda.
Okay, Brad Porterfield, consumer representative, CAC chair, and also the director of the Latino Community Association.
Linda Johnson, COC board member and chair of governance, vice chair of the Health Council community representative, and a member of CAC, and my pronouns are she, her, and hers.
Next, Myra, then Stacy.
Okay, sorry if it's a little noisy. I have all of my coworkers here, dogs, four-legged ones, they're making noise. So my name is Mayra Benitez. I am a consumer rep and a community member.
I'm Stacy. I'm community representative, CAC member, and my pronouns are she, her, and hers.
Great. Next is Teresa and then Tom.
I'm Teresa Olander. I'm a community rep.
Hi, I'm Tom Kuhn, Deschutes County Public Health Representative, CAC member, and he, his, him.
Let's do Connor and then Elizabeth.
Hi, my name is Connor Carlson. I'm a CAC consumer member.
I'm Elizabeth Schmidt. I'm a CAC member, and my pronouns are she, her, hers.
And then Ken and Mandy.
I'm sorry, did you identify me? Or was it Tanya?
Yes,
Okay. sorry.
No, Ken, yes, could you introduce yourself? Thanks.
I missed her again. Ken Wilhelm, I'm a CAC member representing the community. My pronouns are he and him, and I'm with United Way.
Hi everyone, Mandy Seeley. I use she, they pronouns, and I'm a consumer rep in Sisters.
And Miranda, our last CAC member for today.
Afternoon, I am Miranda Hill. My pronouns are she, her. I'm from Klamath County Public Health and I am a CAC member.
Great. Next, we're going to move on to the Health Council staff. Let's start with Donna and then Michaela.
Hi, everybody. Good afternoon. My name is Donna Mills, and I serve as the Executive Director for Central Oregon Health Council, and my pronouns are she, her, and hers.
Hello, everyone. I'm Michaela Arsenault. I'm a project manager at the Health Council, and my pronouns are she, her, and hers. And I also have the role of CAC coordinator, so I support your work during the meetings and behind the scenes.
Let's do Gwen and then Camille.
Hi, Gwen Jones, she, her, hers, also project manager. And I do similar work to Michaela in that we're supporting the meetings, talking with you all offline before and after the meetings and preparing things.
Hi, I'm Camille Smith. I'm the admin at the Central Oregon Health Council, and I use she and her.
And then I'm Kelly Adams, admin services, she, her, hers for the Health Council. And now on to our support and our guest, Kristen and then Tanya, please.
Good afternoon. My name is Kristen Tobias, and I use she, her, her pronouns, and I am the Community Health Coordinator for Pacific Source.
Hi, everyone. Tanya Curiel. I work for OHA in the Community Partner Outreach Program, and I'm the Regional Outreach Coordinator for Central Oregon. Thanks.
On to Rebecca and then Trisha.
Hi, I'm Rebecca Donnell. I am an innovator agent with the Oregon Health Authority, and my pronouns are she, her, hers.
Hello, everyone. Trisha Wilder. I use she, her, and her pronouns, and I'm the director of the CCO here in Central Oregon. Nice to be with you all today.
And then I see one phone number ending in 5002.
That's Buffy.
Oh, there we go. Buffy, could you introduce yourself?
Hi, Buffy, are you there? Can you hear us? There you go. Maybe. Would you like to introduce yourself, Buffy? Okay, well, let's try to give her an opportunity to introduce herself. Maybe right before the breakouts. Try to remember to invite her to introduce herself. All right, well, thanks everybody for being here. Fantastic group of people. Regina is not with us, correct? Do we know if she plans to be with us, or do we just not know?
Not today.
She's not going to be with us today?
No, not today.
Oh, okay. That's too bad. We did do, the CAC voted on who will be our next vice chair. And thank you to both Regina and Elizabeth for your willingness. And it was very, 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 very close. But Regina was selected. And so the next meeting, when she's there, we hope we can acknowledge her again, but Regina Sanchez will be our next vice chair. thanks everybody for your votes. And thank you, Elizabeth, for being willing. And I also want to make it clear that one of the main things that the vice chair can do, other than step in for me if I can't make a meeting or any other obligation, is participate in developing our agendas. So we do that once a month, a couple weeks before our meeting, and that's actually, anybody can do that. Anybody can join that. So Elizabeth, I just want to invite you to join that if you'd like to. And you can just let Michaela or Kelly know that, that you'd like to do that, and they can add you to the list to when we when I send out the invite for the calendar invite.
Thank you.
Yeah. All right. So public comment, patient story. I know we have a patient story. Let me ask for public comment before we go to that. Is there any public comment? Public comment going once, going twice. All right. Thanks, everyone. So Stacy, I believe you're going to share a patient story.
Yeah, I haven't shared a patient story obviously with you guys before. So do I just kind of start?
Yeah, go for it.
Okay, so this patient story that I wanted to share with you guys today was about the first time I had to really navigate the healthcare system while on OHP, or rather one of my kids on OHP. I had always had private insurance myself, so it was something that I hadn't experienced until after I had my kids. And everything went smoothly up until we started going out of the realm of just regular checkups, like, you know, well child visits. It was after my daughter started preschool and she started to get sick more often than normal, even more normal than like a typical kid who just starts to be around a bunch of other kids. So I was aware that, you know, there was that issue. But after a couple months of her being sick, and each time she would get sick, it would be worse, or she'd be sick for longer, I called my daughter's pediatrician office, and I wanted to get an appointment for her to get checked out because I was concerned that she may have asthma like I do and my mom did. And what ended up happening was basically I called. I felt like as soon as I called to make the appointment, I was given a little bit different treatment as soon as I had said, you know, I want my daughter to be checked out again. They were like, no, she's already had her well child appointment. You only get one of those a year. And this was a while ago, but I still remember the conversation pretty well just because of the demeanor behind, I felt, the conversation. Anyways, so I pushed again for the appointment. The best they could do was get me an appointment for 3 weeks later, even though my daughter was pretty sick. And then she told me that I should just call the nurse hotline if I had any concerns. So a few days went by and my daughter got worse to the point where I called the nurse hotline, I left a message, and by the time the nurse had called me back, I was actually heading to the ER because my daughter was having trouble breathing. And sorry, I'm looking at my notes here. And so some of the reasons why I took her to the ER is she had 105 fever. She couldn't talk to me. You could see her collarbone showing, her ribs. All those things are, like, you know, pretty well-known asthma indicators or breathing difficulties. And so I took her in. The person at the front rushed us back right away. They gave her medication, and basically we're like, oh, just check up with your PCP in the morning and see about getting like an asthma diagnosis. They also had did an x-ray at the ER and said that she had pneumonia. And even after that, it was still hard to get an appointment with COPA because of having OHP. By the time we finally got an appointment with the doctor, they told me that it was really hard to get an asthma diagnosis because my daughter would have to have a certain amount of incidences before insurance would pay for the medication. So basically I was pretty like dumbfounded by it, because I was like, okay, so my daughter has to continuously go back to the ER in order to get a diagnosis, to get treatment, to get medication. So along with the ER visit, the ER doctor had ordered not only antibiotics, but a nebulizer. And we had a certain amount of medication. We got the nebulizer machine from Norco, the medication, we used it. About, I want to say a month later, the prescription for that nebulizer was up, and they demanded that, like, you need to return it, your insurance isn't going to pay for it anymore, blah, 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 blah. And I basically was like, how do I keep it? Because it's the only thing helping my daughter. And Norco's like, you need to get a prescription through your doctor, a new prescription written. Anyways, the doctor wouldn't write it, and I still didn't return the machine. After we ran out of medication for the machine, my daughter got sick again. We ended up back in the ER. That time, the ER doctor was like, you know, this was a close call. Her oxygen levels were pretty depleted. And they started to give me like a hard time. Like, you really should take your daughter's health, sorry, that's a cat, into like more seriously. And so I had to explain to the ER doctor, like, look, I can't get my daughter diagnosed with asthma. I can't do this, this, and this, and I don't have medication anymore for the nebulizer. And then I asked to speak to a respiratory specialist at the ER, because that is something that my mom recommended that I would do, because she was a paramedic and she was more familiar with how things kind of work in the ER setting. Anyways, he was like, oh, okay, well, I'll put in a call. And then the nurse had pulled me aside and said, hey, here's like a handful of medication, don't tell anybody, which I know is bad and that's illegal for the nurse to do, but she could see that, like, the struggles with trying to get my daughter diagnosed with asthma. And she said it's something that she had seen quite often, which was the issues with providers and insurance, especially OHP. And so she stuck me like a little handful of albuterol for the nebulizer machine that I was holding hostage. So anyways, 3 hours went by. I talked to the respiratory therapist and explained what happened. And he's like, you know, this isn't uncommon. Again, this is something that's seen, but it's not what your doctor at COPA said. Like, there are ways to get your daughter the help she needs without her ending up in the ER every other week. It's just a matter of knowing how to do it and talking to the insurance company the way that they like need to be coded or needed to be talked to. And he asked for the doctor's name, and he said, I'm going to call them in the morning. This is ridiculous. So the next morning, or like that same morning, because each ER visit were like 5 or 6 hours, I waited for him to call like he had asked. And then by the time I called, I talked to the receptionist, and it was a completely different like attitude, because he had called before me. There was notes in my file for my daughter, like to see a different provider, and which was great, because the new doctor that we saw was very well in tune with kids with asthma. And basically from there, we went to this new provider. This provider's like, hey, it's super obvious that your daughter has asthma. I'm so sorry about what's happened. It is true that it is difficult to get insurance to pay for asthma, but with the severity of your daughter's asthma attacks and how often she's in, it should have never got to this far. And so she got us started on an asthma plan to where we saw a specialist. We got her on medication. We still struggled a little bit with getting the right dosages. We ended up having to put her on a steroid medication after she was hospitalized. But basically 7 years of preventative care, she hasn't been to the ER. She hasn't had an asthma attack since struggling with the insurance company trying to get her diagnosed, and with the provider not knowing how to talk to the insurance company. And I think my main point of the story is it's really frustrating as a parent of of a patient who's has OHP, and then the providers maybe not being well trained, and then OHP not really knowing what's going on. And it's hard because during that time, you know, my daughter went through a lot of stuff. And for me, I was really persistent, and I'm pretty confident in like sticking up for what I think is right and things like that. But I worry a lot about the patients or parents of the patients who maybe don't have that same ability to basically be like, no, this isn't right. This can't be the way it is. And it's hard for me to even imagine someone who maybe even has like a language barrier and the things that might happen if there's nobody advocating for those people. And so the reason why I brought a story up from 7 years ago is because it's still something that I struggle with my daughters because they're still on OHP. And if it wasn't for the help that I got from like the specialist trying to like tell me like, hey, there is a different way, you just need to say this and you need to say that, and you have to really push this issue to get things taken care of, I wouldn't be able to as effectively and I'm sorry, the cat is being so obnoxious. Be able to get my daughters the health care that they need. And in the 7 years since the first time, I'm like, holy smokes, like what's going on? And now it's almost like I have a pattern of one, okay, this didn't work, so I need to do this. And if that doesn't work, I need to do this. But I don't think it should be that way. I think that if you're on OHP or you have a family member on OHP, it shouldn't be like, shouldn't have like cheat codes on how to deal with it. Like it shouldn't be so difficult to get the healthcare that you need, if that makes sense. And I think it would be really important for to take care of the issue of maybe the stigma being on OHP and getting treated differently by some of the gatekeepers or the receptionists, to have more training for them. And then as well as having providers put in their inputs, like, you know, we have patients like this and we code it, but we're getting denial or we're getting this back. You know, I just feel like there needs to be more communication on every level of the system to make things work better.
Thank you, Stacy,
Yeah.
for sharing your story. Yeah, it's really, I think, highlights a lot of things. And like you said, the self-advocacy, like the ability of parents or consumers to advocate for themselves or their kids, is a really important point. And I think there's a lot of people who are not comfortable doing that necessarily. So anyways, you raise a lot of your story, your experience raises a lot of interesting and challenging points. Hopefully things are better than they were 7 years ago, but I don't know. And we don't have time, unfortunately, for really commentary or anybody to say anything about your story, but I'd encourage anybody who if it's okay with you, Stacy, anybody who might want to talk to you about your experience to reach out to you directly. Is that okay?
Yeah, that's fine. I tried to hurry. It's a
No, no,
long
no.
story.
Yeah, no, it was, but that's what made it rich and more interesting.
Just to be
Yeah.
clear, it took me almost a year to get her diagnosed.
Wow. Yeah, frustration. That's what I imagine you felt. A lot of frustration. Well, real quick, not real quick, but can we invite anybody who didn't get a chance to introduce yourself earlier to introduce yourself now? I know Buffy, you'd like to introduce yourself, and then did Renee join us after we did introductions, or?
Yes, Renee
Okay.
joined us afterwards.
So Buffy and then Renee. Buffy, are you there? Would you like to introduce yourself? Say hello.
Yeah,
Hi.
yeah, I was muted, so I never know when I'm muted. So I apologize for that. But my name is Buffy Hurtado. I'm an enrolled member of the Confederated Tribes of Warm Springs. I am the tribal liaison for Pacific Source. Thank you.
Thanks, Buffy. Welcome.
Hi, everyone. Renee Worth. My pronouns are she, her, and hers, and I'm one of the project managers with the Central Oregon Health Council. Thanks for having me.
Thanks, Renee. Welcome. All right. I think we have a announcement from Linda, and then we're going to go into, oh, I'm sorry. We have our meeting notes. We need to approve our meeting notes from, what month are we in? From January. Would anybody like to suggest that we approve our notes?
So moved.
So moved. How about, let's go ahead and do the 5-finger voting. You can put up your hands on the screen. It looks like everybody, the CAC members, you have your video on, I think. We got all fives. Okay, thanks everybody. Notes from January are approved. Now, I think we have Linda, you have a brief announcement to make?
I have two very brief announcements to make. One is to remind you guys that I think last month or maybe 2 months ago, Donna announced her well-deserved retirement. And the board has formed a search committee and we've started the search process. We've had an initial round of interviews and we'll be narrowing those interviews down to, I think, probably 2 candidates. And the next step will then be sometime, Donna is working on a date now. We thought it was going to happen in 2 weeks, but not going to happen. We'll be convening a second round of interviews with the search committee, as well as a meeting with between the candidates and members of the public partners, as well as members of CAC. And as a search committee member, I just wanted to go over the process with you and let you know that we receive information about the candidates from lots of different places. We receive it from the application, from the search consultant and her interviews, from reference checks back in the applicant's community, from the interviews that the search committee does, as well as any feedback that we have from CAC and community members. So if you're able to attend those meetings, we encourage you to do it. And if you have thoughts about the candidates, please forward those to us so that we can take all of that information and make the best selection that we can. The search committee will make a recommendation to the board, and then the board will have the final authority to approve it. So any questions or additional comments, Donna?
I don't think so. I think you got it, Linda, and hopefully we will have a date soon.
Great. Thanks for keeping us posted on it, Donna. The second bullet, just quickly, is I attended and participated along with Michaela in the Oregon Health Authority Transformation Initiative, which is education sessions once a month for CAC members. And this month's session was particularly impressive for me. And as we approach, we meaning this CAC committee, in the next year, we'll be working with staff to update the regional health assessment. And that was really the focus of the session this time. They had a wonderful facilitator. And it was, for me, this will be my second go around of the Regional Health Authority. And I think I have a better understanding as a result of the workshop. And so I've talked with Brad and with Rebecca and with Donna, and there's a possibility that if the group is interested, we might bring it to the group at a time that works for us, so we can all have the benefit of that. And so we can be more informed and participative in the RHA process. So that's all I want to say for now. But trust that in a future meeting, we can have a bit of a discussion about it.
Thanks, Linda. Sounds good. Any questions or comments real quick regarding either of Linda's points before we move on? Okay. And I want to ask each of you individually, because we don't typically have much comments at this time on announcements. So let's see. So we're going to go into our small breakout groups just to get to know each other better. But I want to ask everyone on the agenda, Michaela, Kristen, and Tricia, and Gwen, do you feel like we're running a little bit behind? So do you feel like we'll be able to do your items in less time?
we're going to be taking a poll on decide between these 4 documents, which ones the CAC wants to review. And then we'll break out into 2 separate groups and review 2 documents at once. And I think that'll take at least 10 minutes.
Okay. Gwen, any less, can we do what the last item in less than 15 minutes, you think? It's gonna be tight, I know.
I can try, we can get a couple, do a quick share out and get a couple of questions out there and then follow up via email if we need to. That'll be fine.
Okay. Okay. Well, let's, is anybody opposed to cutting our breakout sessions from 10 to like 7 minutes? Just to earn a little time and not keep anybody late. All right, let's do that. Do we have a particular question in our breakout groups that we're gonna talk about, respond to, share about?
Yeah.
Oh, there it is on the screen.
I was gonna say, can you see the screen?
Sorry,
Yeah, do you
yeah.
have any new hobbies? Are you learning anything new? Do you plan to travel to a new destination? I've split everybody up into groups, so I'll send you there now.
And the folks on the phone, how do we?
Buffy
state
should,
your name?
yeah, she should bump over to her her room.
So they get to go into breakouts. Okay, fantastic.
Was Elizabeth able to make it? Okay.
Okay, everybody should be over.
Let's do 5 minutes.
All right, everyone is back.
Yeah, thanks everybody. That's always funnest part of the meeting. Let's jump into Michaela and our community health project discussion and vote.
All right, thanks, Brad. So today you're going to make your final funding decision on that extra 61,000, and this is from your 2021 community health projects. And you will make this decision in less than 25 minutes, but you have done some legwork and I'll share those results with you. So let's get started. All right, so the proposals that you were reviewing was Thrive of Central Oregon, Lifetime Vision, and Treehouse Therapies. And you ranked them and provided your feedback, and we have those results compiled for you. And so these are the results of the survey. So Treehouse Therapies ranked first for funding, and then followed by Thrive of Central Oregon, and then lastly is Lifetime Vision. So these were the rankings, and 8 CAC members completed this survey. And then for the comments section, we asked what you liked and what you didn't like about each of the projects. And if you have a hard time seeing this, Kelly emailed this out to CAC members, I think around 11 o'clock today. So if you want to pull that out of your email, it might be easier to read, but I'll read through these. So for Thrive of Central Oregon, their proposal was for just over 79,000. And in the survey of what, the question of what you liked, you said, or CAC members said, with housing shortages everywhere, these services are in urgent need. They help with housing, and I think this area needs as much help as it can get with anything housing related. The goal is to provide long-term stable housing after assistance payment ends. Nothing. Involving clients to empower them, provide support in reducing access barriers, strong partnerships, services in English and in Spanish. It focuses on housing stability and is throughout Central Oregon. It has a broad scope of area being served across Central Oregon. And I love that they are contributing to rental assistance, which is so crucial right now. Comments around what folks didn't like or had concerns around this project. The first comment is, it's about funding their business. Limited access for Native Americans, not a best practice. Sustainability, what happens after the funding runs out. They're requesting more than what we have remaining. Will this still work for them and this particular request? Also, they state they are receiving funding from Bend and Redmond. Does this mean a particular % of our funds must be used in those two cities, or are they free to be used wherever Thrive thinks is best? It is pretty narrowly focused on rental assistance. So that was Thrive. Comments around Treehouse Therapies, physical, occupational, and behavioral health therapeutic. Their proposal is for 45,000. Comments around what folks liked. First comment is, I like that they had a pilot group in 2021 and the preliminary findings were successful. After the last 2 years, our youth needs even more behavioral health assistance. It supports kids and families with behavioral health challenges. There's not a lot of programs like this in our area. More accessible service, actually using funds for clients, serving underserved child population, disabilities, and foster care. There's 300 on the wait list. Open to Warm Springs Clinic. Involves parents in therapy, two-generational approach, peer support. Focuses on therapeutic services throughout Central Oregon and has over 300 children on their behavioral therapy waitlist. Recently opened an office in Warm Springs. I like how both children and their parents are being served, helping reinforce effectiveness of the program. I liked it targeted families and children's often overlooked. Concerns about this proposal, will there still be a long wait list if a family does not have transportation to and from Warm Springs to access services? Is there any transportation provided or plans to have sessions in Madras? It's still in development. Sustainability, what happens after the funding ends? And then moving on to Lifetime Vision Care, and this project is 7,200. Things that the CAC liked about this. I like that they have a very obtainable goal. Vision support is not often seen, I think, and it's so important plus expensive to buy glasses. Provide vision care regardless of income. Funds used for clients' actual needs. Addresses inequitable access. Vision care helps increase and support self-sufficiency to those without the means to pay for this care. Seems like a good initiative for a small amount of funding being requested. What can we can fund the entire thing. And then the concerns around this project were not a best practice, too small a project to make much impact. Looking to support at least 24 people, part 4 of the application with this funding. But the final page, they talked about 72 to 144 people. Pretty simplistic, but fine for requested amount. So first question, kind of get us talking about the projects, and then we'll kind of go into more decision making. What were some other things that you liked about these projects? Or if you wanted to elaborate a little bit more on your comments on the survey.
Can I ask a question?
Go for it.
Isn't the initial application for the grant application doesn't allow the recipients to give rental assistance?
Correct. These funds can't be used for rental assistance, like actually paying for rent.
Okay. But they're actually Thrive's asking for the money for workforce, correct?
Correct.
So if the money is for workforce and not for rental assistance, the workforce will do what? Have a capacity to talk to more people, but not have the additional funding for rental assistance, or we're not clear on that.
Yes, so you're talking about the Thrive application.
Yes.
Would someone from the CAC like to speak to that?
If I'm not mistaken, they are essentially, they need funding to have more staff to be able to provide more rental assistance. Is that, and the other services, the information referral, the other things that they do at Thrive?
Correct.
Okay.
That's
Thank
my
you.
understanding. There.
And they mentioned a couple of places where they're applying for funds. Those funds will be more directly for assistance, and there seems to be money continuing to come from sources like the state just put some more money into housing and shelter. I don't know that it directly applies, but that's the point, is that the direct assistance would come from other places, and this would help expand the capacity that they have to get that money out to where it's needed.
What other things do you like about the projects?
I'll just chime in briefly on the treehouse therapies. Really nothing to add beyond what everyone has shared here, but it just, there really is a strong need. There was before COVID for mental health support, counseling for school age kids, and it's just gotten, the need has gotten greater during COVID from everything I'm hearing. So I think I'm happy to see that kind of rise to the top. I think that's a good choice.
I particularly like that Treehouse is reaching out and placing services in the Warm Springs area.
Thanks, Linda. How about things folks liked from some of the CAC members that we haven't heard from? Or maybe concerns that you have around the projects?
I guess one question I have is Thrive is requesting more money than what we have available. Is that an issue for them or for us?
They, if approved, they would need to submit an updated budget.
And Michaela, just to clarify, when you say that, you mean if we were, let's just hypothetically, we were to say, we can fund $20,000 of what they've asked for,
Mhm.
they would have to submit a budget telling us how they would spend the 20,000.
Yeah, and it'd have to go towards this project. So maybe it's like a piece of this project.
Okay. Do we have any information to answer some of the questions that are down in the concerns section? Either CAC members who know or staff that's reached out to ask the answers to these questions? Or...
So looking at Thrive, they're requesting, so that was Connor's question. So also they state they're receiving funding from Bend and Redmond. Does this mean a particular percentage of our funds must be used in those two cities? Or are they free to be used where Thrive thinks? So those funds, the proposals to be used for clients across Central Oregon. So our funds would not be limited to Bend and Redmond, the CAC's funds. And then moving over to Treehouse Therapies, will there still be a long wait list? I don't know. I believe the goal of the project is to reduce that wait list. If a family does not have transportation to and from Warm Springs to access services, is there any transportation provided? That's a good question. I don't know. And I also don't know if they'd be eligible for the NEMT benefit for these services.
Michaela, this is Michaela.
Go ahead, Buffy.
So as long as they have OHP, if transportation was necessary for any of Treehouse's services, they would be able to call in and schedule transportation.
Thanks, Buffy.
No problem.
And then do they have plans to have sessions in Madras? The proposal didn't mention Madras. I think those are the questions.
I just had one other question about the two comments. If whoever made the comments about not a best practice is willing to say any more about that, I'd love to hear it. And that's for Thrive and the Vision.
I think I was the one that made those comments, Brad. It says observation as much as anything. Not every, I know when we fund, we like to see things that are essentially proven. I'm blanking on what the correct phrase for that is, but they're research-based or resource-informed. And then a best practice is kind of third on the list. But there are good services that happen without being any of those things. And particularly the type of those services are, don't lend themselves to research.
Thanks, Ken, for clarifying.
Brad, could I make a proposal just to get a conversation started about funding and what are just sort of moving us down the pipeline to a decision, something to push back against?
Yes, let me just do one quick reach out to, and I can't see everybody, but Mandy, Myra, Teresa. Sorry, I'm having trouble seeing Stacy. Just anybody else real quick. If you have a comment or question you want to make before we do that.
Sure, I can make a comment. Sorry, this is Maida, just in case you can't see who it is, Brad. With the tree house, I was really excited to read what their goal is, and to know that they're going to be not only reaching out to Warm Springs, but they've opened up an office in Warm Springs, which is even more accessible. So the fact that they put thought into that is really nice to hear. With Thrive, I mean, they're trying to help as many people as they can. I know that it seems like it was more geared towards rental assistance, which is something that it sounds like, the money's not for rental assistance, but for maybe employees that can help with all of that. But I'm definitely into the treehouse one.
Thanks, Myra. Anybody else?
Brad, this is Buffy. Can I just give a little bit more context and history for the CAC regarding Treehouse Therapies and their relationship with the Confederated Tribes of Warm Springs?
Yeah, please.
Okay, so we're going to have to kind of just rewind about 6 or 7 years ago. There was this conversation that actually I was part of as healthcare analyst for our tribe, regarding looking at those gaps in bringing assistance to our kiddos that was outside of the scope of what the school district could provide. And so at this time, there was a lot of education and discussion around what that could look like. And out of all of the different entities that maybe over time we would have conversations with, Treehouse Therapies was the only one that was really willing to look at what potentially that could look like. And so through this, they also had the relationship with Diana, with Codison, to really try to get into our society and figure out how can we bring these services. And this conversation would incorporate our entire health system, as well as community members. And, Diana really helped partner with Treehouse and showed Treehouse how to come in and do like an MOU and an MOA, and how to facilitate these conversations and just to keep that work moving forward. And when they opened up the doors, all of this time and space, when I look back on the road about how many hours and, commitment it took to do this work, I was really excited, because what I heard was from a grandmother who's raising her child, her daughter's child, so her granddaughter, that is on the spectrum, was able to go to this clinic, meet with individuals, and begin a journey forward. And so, they're willing to put out all of that research. And I think me and a couple of the other tribal members added up, and we want to say it's like right around 7 or 8 years it's taken us to get to this point. Thank you.
Thank you, Buffy. That's really good information. So that's definitely a vote of confidence, at least the way I understood it, for Treehouse Therapies, correct? Support for Treehouse Therapies. Okay, well, thank you, Buffy. Michaela, and I'll let you answer Linda's. Do you want to let Linda speak up about her idea about how to move forward? Do you already have an idea, Michaela, about how to move forward? Or?
Yeah, were there any other comments before we get to Linda's suggestion, recommendation from the CAC members? All right, Linda.
Great. Well, what I will propose is that the CAC approve full funding at $45,000 for Treehouse, and then the remaining funding if it would work, would go towards Thrive. And the reason I make that proposal is that Treehouse is going to be providing direct services. It's the type of service that the needs have been identified collaboratively with the tribe. So they've worked very collaboratively with the partners. And I really appreciate Buffy's comment that this has been an 8-year-long collaboration. And it really feels like it's a direct service to deal directly with a real problem that with an underserved population. And Thrive also is providing in their proposal staff services to help people stay in their homes and to avoid homelessness, and houselessness right now is a major issue throughout the region. So I feel that both proposals address top priorities, but for all the reasons I mentioned above, I would fund Treehouse fully at 45 and put the remainder towards Thrive.
Reactions to that proposal, to that recommendation?
Yeah, I think it's clear that Treehouse stands out. And so since we have more than enough funds, I think we can knock that off pretty quickly. And then the discussion about Thrive and Lifetime Vision Care, their scoring actually was very close to each other. And then so I think it'll be other factors, maybe like what Linda talked about. But I think we could knock out the Treehouse therapies first and then debate or discuss the other two.
It's Elizabeth, and I'm really for this vision, because if you can't see and you can't read, you can't go ahead in life. So I have to buy reading glasses at the dollar store. I can't read reports without them. So I really realize how important it is.
Can I follow on that? I think I agree with Elizabeth. And I think if you are hesitating about it's small, the vision care, I'm for Treehouse because of what we talked about, and vision, funding both those. And then personally, I think the access should go to vision. But I think if you are hesitant about it, blindfold yourself and live like that for 24 hours. Seriously. Take away your vision and see how difficult it is. And even though it's small scale, they're helping a small amount of people that wouldn't get help at all. And it'll grow over time. That's my 2 cents.
Let's hear
So
from
everybody- Go ahead, Vicki.
Let's hear from some other CAC members.
So I'm going to agree with Elizabeth and Teresa. I love and support Thrive very much, and housing is kind of my passion. But I also know that Thrive is very resourceful, and I don't think that they will not be able to get the funding. So my suggestion would be to fully fund both of the others, and then just whatever's left, give to Thrive so that we can support all 3 of them.
Stacy?
That's what I was thinking as well. I know Thrive helps people who maybe don't know how to navigate certain systems, or helps people kind of get in touch with resources that they don't otherwise know about. But I feel like the vision is really important because there's not a lot of outlets for that, or resources, I should say.
I think I'm going to hop on with everybody and agree to fund the vision and Treehouse.
Okay.
Yeah, I second that. I say we fund all 3 with the balance left after the vision and Treehouse given to Thrive.
I can support that.
Okay. Would someone repeat what they're hearing the consensus is? Then we can do like a 5-finger vote. Brad?
Yeah.
Okay.
Yeah. I guess I could help with that. So 100% fund treehouse therapies at 100% of their ask, fund lifetime vision, is that the right? At 100% of their ask, and then give the remainder, the balance to Thrive. 5-finger vote. All right.
All right. I see everyone's hands. I think it
We had all. Yeah.
Awesome. Thank you all. Fantastic work, everyone. And you have just invested around $748,000 into your community. So congratulations on a job well done.
Nice to have everybody. All right, so we are running behind, but we're doing fantastic work. That's what really matters. So we have, let's see. I'm not sure, I don't have any solution to solving our time issue other than to check in once Kristen and Tricia start to see if after an orientation, if giving our feedback could be done offline. That's just one thought. Maybe that's a good idea. Maybe it's a bad idea.
No, that would be fine too. I mean, we could select the documents and then receive feedback however works for the CAC. If that's email, if that's a discussion, we want to be flexible and accommodate you guys. The discussion you just had about investing in our community is so important, so I don't want to cut anything like that short. But I can sort of level set on why we're asking you to take a look at these member documents. Our CAC members are literally the voice for our 69,000 CCO members in Central Oregon. And so having you guys look at these documents and provide feedback as we're working to update them and then republish them hopefully by the end of this year or early next year. We really, really want to hear your voice and hear your feedback and suggestions how to make these documents more readable, easier to understand, or maybe they're great the way they are. Of course, there's some things we can't change, like the color scheme and logo. That's a Pacific Source branded type thing. But as far as like, the words that we use or how the materials are displayed and outlined, those are all things that we would love your feedback on. And then we'll submit that to our marketing team. And they'll compile feedback from the CACs across all of our 4 regions. And then again, we'll work to update those documents with your feedback.
Thanks, Kristen. So in the interest of time, I do apologize.
That's okay.
We're always running out of time. Let's do a 5-finger vote on the idea of working now on choosing the 2 documents. It's 2 out of 4, right? And then giving feedback offline, either through email or calling Kristen or Tricia, emailing Kristen or Tricia. Want to do 5-finger vote on that? Okay, let's do that. Thanks, everybody. Kristen or Tricia.
I actually think, Kelly, did you have a poll to decide the 2 the 2 documents that we're going to take a look at?
Yes, I'm going to launch a poll right now. If you could choose your top 2 documents that you would like to review, and then overall we'll take those 2 and go forward with those.
Great, thank you.
Thank you for putting the poll together. That's making this a lot easier. And just to be sure, Buffy, who's on the phone, does she have a vote? I apologize for asking them. Do we want to get input from Mandy?
No, I don't have a vote, Brad. I'm just support of you guys.
Okay, thanks, Buffy. That's what I thought, but I wasn't sure, so thank you.
And if you're not a member of the CAC, would you mind just clicking on no vote, just so I can see that everyone has voted that should be? I've got about, yeah, there we go. Just want to make sure everybody's voice is heard. Okay, I'm going to end the poll right now. And here are our results. So it looks like our top two is, our first one is your health and wellness journey map, and the second one is the Oregon Health Plan Member Quick Start Guide.
Excellent. So what are our next steps?
I will make sure that the Health Council has those 2 PDFs, and then they can send it to you all in an email. And I'll make sure to include my email to submit any follow-up or any feedback you have. And then I'll also include my phone number, and you're welcome to call me or send me an email.
Okay. And do you have a timeline?
Maybe by the next CAC, if that's fine. The woman who's actually going to be kind of compiling this information is currently on maternity leave, so we have a little bit of leeway. Don't expect her back until April. So I think by the next CAC would be fabulous.
Okay. And
Thank
just to
you.
Just to get an idea, how long are those 2 documents?
Well, they're probably about 2 pages, but the journey one is a little bit longer, but there's a lot of space to fill in your own information on that document. So they're probably about 2 pages if you took out the space for you to write in your information.
Okay. That sounds pretty manageable.
Yeah.
Kristen, I think I looked at them pretty briefly, but are they English only? Do you have Spanish versions?
I could supply Spanish versions if you're interested. Yeah.
I'm not, but I'm sure others might be.
Brad, are you interested?
Definitely.
Okay.
And I don't want to speak
Yeah.
for you. Mary, are you interested?
Yes.
Yeah.
Yes.
Great.
Thank you for that, Connor.
Yeah,
Anybody
that
else?
would be fabulous. I'll
It's
get them in
Maida.
English and Spanish.
It's right, Connor.
Maida, not Myra, Maida.
Right.
All right. Well, thanks. Good work, everybody. And thank you for being willing to do that offline. Give that input. Very important. All right. Well, let's move on to Lynn and talking about our next, our meeting with the dental care organization folks. What that's
Hey
going to
everyone. So we've been talking over the last few months around periodontal and dental care. And last month, over the last couple months, you indicated interest and agreement in initiating a conversation with our dental partners in the region. We had a long conversation last month to kind of form up what that conversation might look like. And so what we did was take all the feedback and conversation and kind of put it into a shape of an agenda with a few other things. So what I'd like to do is show that to you, so you kind of have an idea of what you've designed. I see it on paper. And then we have some really specific questions that we need answered to be able to move forward. So I'm going to actually show you the questions first. We're not going to answer them yet. I'll show you, I want you to see the questions so you know what to be thinking about. Then we'll go look at the agenda and the information about the meeting, and then come back and answer the questions. Okay, so I'm going to share screen. And what you'll see here in the yellow is the questions that we're looking for your direction on. One is, do you want this conversation to be public or private? CAC meetings are generally public, which means anybody can come and go. They can access it from the website. It's recorded and put up on the website so anybody can see it. Do you want it to be private? Do you want it to be, this doesn't have to be a public meeting. It can be just a conversation amongst you folks. Do you want it to be recorded and be able to be shared with folks who may be interested in learning from the conversation, but not at this meeting? So that's like the big, one of the biggie questions. The second one is it possible to make this meeting 2 hours instead of our regular 1.5 hour meeting? And the DCOs, our dental partners, would be joining at our regular meeting time. We would just extend the meeting by a half hour to give enough time. And then this is your all meeting. So what roles do you want to play in the facilitation and leading of this conversation? And then finally, in the planning is some structured, Q&A, question and answer time for you all to ask the dental partners a couple of questions and for them to ask you a couple of questions. So, what questions do you want to ask them as a group? What are a couple of questions you want to agree on? So hold on to those thoughts and questions while I'm going to come back to the top and kind of show you the draft outline for the meeting. All of this is pulled from the conversation that we had last month. So the relational objective. So what do we want this to be like in the relationship sense? You identified that you want both sides to try and help each other. You want to work on the same team, head in the same direction, have the opportunity to work together and come up with some solutions. The outcome, what you'd like to the objective or the tangible thing that you want from this time together is to determine if there's going to be some ongoing conversations to continue progress and really look at initiating some policy reform. We're proposing that the conversation be 2 hours, given what needs to happen. It would be take place during your regular CAC meeting time, so it wouldn't be an additional thing on your schedules. We have a list of potential participants. So we've got you all, the CAC members, COHC staff with Donna, Michaela, Kelly, and myself. We've got our OHA Innovator Agent, Rebecca Donnell, who you're familiar with. And Rebecca, I'm realizing I misspelled your last name. My apologies. We have our OHA dental executive, if you will, Dr. Kaz Rafia, who's indicated interest, and he comes from the OHA policy level of this conversation. Our Pacific Source CAC liaison, Kristen, who you're familiar with. Our Pacific Source medical dental director, Dr. Ash. And then a couple of folks from each of the dental programs, from Advantage Dental, Capital Dental, and ODS. And thanks, I'll add those titles in. This is obviously draft, so we'll correct those names. So that's kind of who the folks that would be in the room based on our conversations and people who are interested. You all identified some preparation materials for both yourself and our dental partners that would include the CAC purpose and goals, guiding principles that you outlined above, or actually are going to be actually below, next bullet item down, sharing of the emerging issues patient stories that have been shared so far. So they've heard the same things you have heard. And then any highlights that are pertinent from our preparation discussions. So they would be provided with all this information. Guiding principles, things that you like commitments to each other around behavior and communication and interactions during the time together with our dental partners. You've identified that you want it to be problem solving, collaborative, respectful, no pointing fingers, recognizing the validity of what's being shared, unbiased listening, hearing both sides, and expecting unfinished business. This is, the beginning of something, and it'll be unfinished. Any questions about those things before I move into looking at the agenda?
Hey, Gwen, just real quick, the use of the language, I know this is just kind of a very rough, but talking about sides, let's just avoid talking about sides.
we're going to do a lot of cleanup. I just wanted to show that, you know, we'll definitely make it a little bit more inclusive. I don't know, whatever. Yeah, we'll clean that up. But these were your language, so I wanted to make sure that you saw that that was captured. Yeah. All right. Any other questions of clarity around those parts? Okay. I'm going to go back to sharing screen and look at the agenda piece. So this is a draft agenda based on what you're looking for and some of your ideas around the format. So the meeting would be potentially be broken up into 3 sections. This first is this introduction, where you've got the welcome. And this is where we just, you know, welcome everybody in, but talk about why we're coming together. Then it's large group, like we do at our CAC meetings. Everybody goes around and shares their name, pronouns, your organization, and role, so everybody is aware of who's in the room. And then small group introductions, where we break into small groups like you already do in your CAC meeting, with a get to know you question. And this is the consideration for putting this in, is to help make people more comfortable with each other, and get to know each other as people, as well as professionals and CAC members and whatnot working on a project together. Then we'd move into learning about each other's experiences and work. So the CAC would share a summary of the barriers you've experienced in the dental and periodontal worlds. And they'll have had the patient stories and have had some preemptive. So this would be kind of a summary. And then giving the DCOs to respond and share an overview, be able to respond to the initial barriers, and be able to provide their experience back to you around what they're trying to do and the barriers they experience as well in providing services. And then CAC, you would have a chance to respond to them. And so this is kind of a conversation, but it's kind of a facilitated conversation. And then some time for some more formal questions of like CAC would, this is kind of like the Q&A panel discussion. CAC gets to pose a question to the DCOs about something, and the DCOs can respond. And then DCOs can ask you all, CAC members, a question, and you all can respond. And given the amount of time, we can probably do 1 or 2 cycles of that. So 2 questions each, kind of thing. And then that would take us to, once again, feeling unfinished because we just have, you know, an hour and a half or 2 hours. But looking at, okay, where does this leave us? We've started this relationship. We've started getting to know each other and each other's works and needs and barriers. And we'd close up with potentially a poll like you did today, where you have some selection options on your screen, looking at how valuable was this conversation? Are you willing to, you the individual, are you willing to collaborate and problem solve on these? Do you want to meet again and add an opportunity for chat to kind of see where everybody is at the end of this conversation? And then we'd close it out with just a summary of thanks and appreciation for folks coming together, and the knowledge of there'll be follow up in one form or another, depending on where folks decide to, what y'all decide to do. So, a couple questions given the last 4 minutes that I'd like to hear from y'all. Let's start with the first one is, what are your thoughts on changing this meeting for this purpose from an hour and a half to 2 hours? Is that something you all are open to, or are you pretty firm on keeping to an hour and a half?
You're going to have to go 2 or more, or you're not going to get anything done.
Okay. Teresa you said 2, Ken, and Linda, I see thumbs up with that. Tom, thumbs up. Brad, Mira Elizabeth, okay. Stacy, thanks. All right, so 2 is a good, everybody's on board with that. Okay, great, yay. Okay, next question. How do you want this? Do you want this to be public, a public meeting, Do you want it to be a private meeting? Do you want it recorded so it can be shared out, or do you not want it recorded? I'm just going to open it up. There's a lot of pros and cons to each. There can be a lot of different takes on that. So Mandy, you put in the chat public and recorded. Other folks, what are you all thinking?
I would like 2 meetings. This is Elizabeth. First, I'd like our meeting where we get to really concentrate. And then secondly, maybe it could be broadcast to the public through recording or something. I think both are needed.
Okay.
So
you're saying, like, Elizabeth, are you saying, just so I'm understanding, you'd have the meeting real person and then we'd be able to record it and share it as well?
Yes, I think that would be good.
Okay.
Would it
Other
be public
folks?
or private?
What were you asking me, or what?
I just seen what other folks were thinking.
Okay.
Oh, Linda, sorry. Thank you. I can't see you. Thank you.
I agree with
No
both Mandy
problem.
and Elizabeth. Public and recorded.
Okay.
I think I'm going to be maybe the odd man out here. When I think about beginning and developing a relationship around topics where we may not be, or we may be polarized, or we may have very different perspectives. Personally, I like to create an atmosphere of trust and safety for people to feel like they can be truthful about what's going on with them. And having spent a long time in the public eye, I am all about disclosure and transparency, but sometimes it interferes with the developing of a long-term relationship where we can get real with each other and solve problems. And so I'm not immediately excited about a public recorded session that's broadcast live or later.
I would agree, just because I agree with what Linda said, but I also, there's this underlying feeling for me that and I think other people feel it, that because I'm on OHP, I'm treated different than people that are not on OHP. And it's never said, it just feels like that. And granted, these are Oregon health authorities and we're supposed to be working together, but you'd like to establish that relationship first. Like, we're not evil. Hee.
Stacy, do you want to share? And then Ken?
I just agree basically with what Linda was saying. I think the initial meeting to set up more of a trust and personal, and like I could see how maybe some of these people coming in would be like, oh my gosh, we're going to be recorded, this is going to be public, like what am I walking into? Maybe anxiety is a little higher. If the initial meeting is perhaps private and more one-on-one, more trust could be established.
And I was just agreeing with that perspective that you have to build trust first. And so a private type meeting would be more conducive to that.
It's Elizabeth, and since you all have talked about that, I think probably the first meeting should be private, but I think there should be a follow-up public, something for the public, and that could be just presented differently. I don't know. So I've changed my mind.
This is Rebecca. Tanya Curell, who is your regional community coordinator, runs a meeting. Tanya, I don't know if you want to speak about it, but it's a community partners regional meeting every third Wednesday. And we had discussed maybe having something similar, at least having Dr. Rafia come to that group because they receive a lot of feedback. So that might be an option. I don't know, Tanya, it's your meeting. So do you want to share what we kind of briefly talked about?
Yeah, and you read my mind, Rebecca. I was just thinking, as you mentioned, 2 meetings. My meeting is a very public space, and I'll just share a little bit of the context of what it is. I work with all of our OHP assisters in the region, so people who help Oregonians apply for the Oregon Health Plan. So this is a space where people who are engaged with that community on a day-to-day basis come learn about OHP, but also bring back a lot of member concerns. So I wanted to have a similar space for our community partners to be able to express their dental access concerns that they're seeing in the region. So that could be extended to anyone who wants to be there. It's not limited to my assisters. So I could really designate that space as a public forum as an option as well.
Connor, Tom, I wanted to give a chance to hear from you all and then kind of see where the consensus is.
Yeah, I agree with what Linda brought to the table. I think trust is of utmost importance in trying to get a collaborative setting going initially, I think would help that. So.
Yeah, I'm for keeping the meeting private.
This is Buffy. I just have, I guess, a point of clarification for myself. As tribal liaison with Pacific Source, I am kind of in this space where I'm to kind of oversee all of the CAC activities, and where I'm not necessarily a CAC member. When you began to talk about private, that means behind closed doors in my understanding. And so does that mean all of a sudden that now you're putting me on the outside to where I can't do my role as far as like what OHA and the tribes kind of seen for this position? So I just want to get more clarification on that, please.
Gwen, can you?
Buffy, this is Linda. Thank you so much for your comment. My intention when I spoke my perspective on it was not to create an in-group and an out-group. So in the invitation list to the participants in this meeting, I would support CAC members and the CAC community, meaning the people that attend these meetings or close allies on it. So it's inclusive in that way, but yet it's not, we don't invite the bulletin, or it's not broadcast live on a public access channel. I'm just trying to find the balance between inclusion and trust and respect. So thank you for your comment.
And just to clarify, none of our meetings are broadcast, correct? Right. Nobody can watch this on Facebook Live right now, can they? Or can they?
Kelly's shaking her head no. The recording's put up on the website, right?
Yeah, so it's like
the
a
recording
recorded
is
video.
put up on our YouTube, and you can access it through our website.
Yeah, so people can watch like a recorded video after the fact. Just want to make sure that was, yeah, okay. Well, we are out of time, and this is a really important and not an easy discussion, because I feel pretty strongly in the being transparent, being open to the public. I think we're all adults, and all the people representing the dental, service, OHA, the DCOs, they're all used to public meetings, I believe. I could be wrong. Maybe the DCO people aren't, but the leaders of the DCOs, but I know the OHA people are, because they have to be, because they work for public agencies. So I really don't see us. This group is not a confrontational group. We would be making being very clear about the fact that we want to work together. We just happen to have stories where the system's not working so well for consumers, and we want to be a part of making it work better. And I just don't see that being confrontational, or that we're going to have any trouble building trust. So let's take a couple more minutes for final comments, and then Gwen, if you have ideas about how to resolve this.
Tanya, do you want to share your question in the chat?
Sure. Just a suggestion that if folks want a private space, we can create one within Zoom while keeping the bulk of the conversation accessible, open, and transparent. And then maybe whether that's at the beginning or the end, having a space where people know that they're not being recorded as an option.
Yeah, this is Miranda. I agree with what Brad's saying. I think being transparent is the best way. I do like the idea of offering a private breakout session. I know like other advisory meetings do that. They have the first 30 minutes that's private, and then after everything else is open to the public. That's just my thought.
And one other idea real quick is we could poll everybody at the beginning. We could do a poll about, would you like this to be recorded?
Yeah, I think asking the dental folks, you know, what their opinion is as well, if they want to be, you know, private or public.
Yeah, and this is Rebecca Donnell. I can't speak for the dental care organizations exactly, but they are, you know, they are contracted Medicaid providers, and they are often in public settings. And I think they're very accustomed to public conversations. And certainly, as Brad said, you know, myself as an innovator agent for OHA and Dr. Rafi as the state dental director. And with that, I think what we're trying to accomplish through this is a very candid conversation, that even in a public forum, that we want people to come and really share their experiences and really explain what's happening in the community, what's happening in Central Oregon, so that folks can hear firsthand from community members what their experiences are. And so in all of the conversations I've had to prepare folks for this meeting, that is exactly what I've prepared them for, is that they'll be hearing directly from community members firsthand what's happening directly in the community. And they're looking forward to it.
All right. I think we've heard a lot from a lot of folks, and folks are starting to drop off. So we'll send out an email follow-up to see where that puts us at, and maybe include some of these notes so everybody has the full conversation that's happened. And then we'll move forward from there. We'll also send out some follow-up questions around how y'all would like to contribute with facilitating the conversation, or who you'd like to have facilitate, whether that's staff or a mix of you folks. So thank you all. A hard conversation and a lot of different angles to look at it. So appreciate your forthright honesty and vulnerability, and sharing where you're coming from and your perspective. So Brad?
Yeah, thanks. And this is, just to clarify, this is for April or March? March or April? This meeting with dental folks.
March.
So it's the next meeting.
Mm-hmm.
Okay, so we don't get to talk about this anymore. All right, before then, I should say. Okay, well, one thing, just one last idea. We do need to part. If anybody needs to go, please go. And thank you for everything you contributed. But maybe if the staff could, or Rebecca, somebody could poll those participants from the dental, you know, everybody who's not a CAC, regular CAC member, participants of the CAC meetings, to get their input and then share that back to the CAC through email. And then,
Yeah, we're going to be doing a prep meeting so we can gather that information.
Okay, because maybe that'll change the way, maybe, I don't want to assume anything, but that could change the way the folks feel, who feel that we really need to have it private to build trust. Maybe that'll change the way we see that. So maybe not. But thanks, everybody. Looking forward to the next meeting.
Thank you.
Thanks.
Bye-bye.